Hi everyone, I'm Holly Elizabeth and welcome back to the channel. So in this video I'm going to be explaining what a nursing associate is in the UK and basically how the role differs from like a staff nurse, if that makes sense. Sit down, relax, grab a cup of tea and let's get straight into it. So maybe you already work in healthcare or you're thinking about getting a job in healthcare. Maybe thinking about doing your nursing and don't know which way to go. Or maybe you've just heard the term nursing associate and you think, what's that? Because I know I did. So yeah, we're going to go through, what are we going to go through? We're going to go through what a nursing associate is in the UK, what the role is, and we're just going to have a quick look at some of the key differences between the nursing associate and the staff nurse. So I'm going to try my best to explain, okay, so bear with me. A nursing associate is a registered healthcare professional and they're regulated by the Nursing and Midwifery Council, so the NMC. The role it's a fairly new role. It was introduced in 2019 and it was introduced to kind of bridge the gap between a healthcare assistant and a staff nurse. So yeah. Training takes 2 years to become a nursing associate and it's usually done through a degree apprenticeship or a foundation degree. So it combines studying with like hands-on learning as well. So yeah, that's nursing associates in a nutshell. So what does a nursing associate do? So nursing associates provide direct patient care, and that includes things like checking vital signs. So, you know, like your blood pressure, your pulse, oxygen, respirate, temperature, all that good stuff. They do that. They also do personal care and hygiene for patients. And they do wound care, so basically cleaning and dressing patients' wounds. So nursing associates can give medication. They can give some medication, I'll just say some. So I work in the hospital, so from my understanding of a hospital setting, I can give oral medications, but I can't administer IV medications, or there's certain stuff that I can't give, certain stuff we can't give basically. So in my trust, they've basically said for nursing associates, it's optional if we want to do some training to do IV meds, but there's only certain ones that we would be able to give anyway. I haven't done it, I haven't done the training, it's optional, but I think I would. I think it's quite blurry, and I think introducing IV training might be too confusing. It's confusing for me, so I'm avoiding it as long as I can. I can just delegate and that's what we do. Nursing associates also monitor patients and escalate any concerns to colleagues, to doctors, and we also do some documentation. It's very important to document everything, otherwise it didn't happen, so do it, please. Basically, nursing associates, we work under the direction of a registered nurse, but we have more responsibility than a healthcare assistant. Before we go through the differences, let's quickly talk about what staff nurse is. So a staff nurse is also known as a registered nurse. So they have done the full 3-year training, 3-year nursing degree at uni, got the qualifications, registered to the NMC. So nursing associates and registered nurses both register to the Nursing and Midwifery Council, but there's slightly different registers, I think. So we both have PINs and it gives us more responsibility. So staff nurses also take overall responsibility for a patient's care and often they can lead, you know, lead shifts and lead, you know, lead the nursing teams basically. So staff nurses have more leadership and more autonomy from my understanding. Yeah. So now I'm going to kind of go through some of the differences. I've had to think. This is what we've come up with. So hopefully it makes sense to someone. Let's just do it. So the first key difference is the difference in training. So nursing associates take a 2-year course, and it's usually through a degree apprenticeship, or it's a foundation degree. And staff nursing, if you're training to be a registered nurse or a staff nurse, it's the full 3 years. So yeah. There's a slight difference in responsibility. So how they explained it at uni is that nursing associates provide a monitor care. Staff nurses can evaluate and plan care, if that makes sense. So nursing associates sort of support the care delivery, and staff nurses can assess, plan, and have a say in like the management of care. Does that make sense? I don't know if it does. I'm trying though. Another key difference is medication. So like I said earlier, nursing associates can give certain medications, obviously depending on the setting. However, staff nurses can pretty much give all medications, obviously as long as they're competent to give them. I know nursing associates can give injections such as subcut injections, IM injections, but IVs are a little bit blurry. So one of the last differences that I've noted is pay, and this is based on the NHS sort of pay scales. So nursing associates typically get paid a band 4, and there's not really much room to manoeuvre from there. Career progression is very limited unless you do your top up to become a registered nurse. And for staff nurses / registered nurses, their pay usually starts at a band 5, and there's opportunity for pay progression and career progression. You can go into more management stuff if you want. So the question is, can nursing associates become registered nurses? And the answer is yeah, they can. So there is a top-up degree that you can do if you are a nursing associate, and I think, off the top of my head, I think it's 1.5 years long, the top-up. I might be wrong though, but there's a top-up anyway. Yeah, and then you can obviously become a staff nurse through that. So yeah. So going down the route of just doing the full 3-year course and becoming a staff nurse is the more traditional route. The reason I did nursing associate was the opportunity was obviously there in our trust, so I applied, but it was mainly because of finances. So I did the apprenticeship route, so I was being paid to learn. Do you know what I mean? So the trust funded my place to become a nursing associate. So otherwise I wouldn't have been able to afford to do the uni degree, I don't think. I'm quite happy with being a nursing associate. It's just knowing the differences, isn't it? And sometimes it can be a little bit foggy, but I'm kind of hoping that this has explained it a little bit. I'm not really very good at explaining though, so I'm sorry if you've watched this and you're probably more confused than you was before you watched it. So they're the differences between a staff nurse and a nursing associate. If you found it helpful, give the video a like. Let me know what you think. Maybe subscribe to us. Don't have to. Would be nice though if you did. That's it really. Let me know if you want to see anything else. If there's any particular videos that you want me to make, and I'll try my best to do that for you. But yeah, that's it. Thanks so much for watching, guys. See you next time. Bye.